Hey, how are you? Welcome to the Walk-In Laser Eye Surgery Center. Are you thinking about having a quick eyeball surgery today? Yeah? You are in the right place. Let me check and see. Okay, yeah. Yeah, well, we do take some appointments, but you are in luck. We have some time right now if you'd like. Okay, all right, well, first things first, we need to do a couple of evaluations just to make sure that you're a good candidate for the procedure. Okay? All right. I see that you're wearing eyeglasses. Can I take a look at those real quick? Yeah? Okay. All right. Okay. Let's see. Yeah. They're a little dirty. That's no problem. Okay. I'm gonna wipe these off for you real quick. Mm-hmm. Okay. Do you mind? Whoa. Yeah. That is a strong prescription. Wow. Okay. All right. Well, here. All right. So let me just get a few pieces of information into our computer system. Would you start by telling me your name? Oh, okay. Let me see. Can you take a look? Is that you? Yeah? Okay. Yeah. We must have had the rest of your information in our system from another one of our labs or clinics. Yeah, we're all over the place. Mm-hmm. And we don't just do laser surgeries. So chances are you had, a small walk-in procedure done at one of our other locations. Okay. All right. Well, let me just put this in here. Okay. So let me grab my list. Now, I am going to do a physical examination just to make sure everything looks good up there and just to determine your eligibility. But first, we'll go over this part here. Now, there's certain health conditions and issues that you might have that increase the risks associated with LASIK surgery. So these conditions can make the results of the procedure less predictable. Do you have any of the following? Autoimmune disorders such as rheumatoid arthritis? Okay. Do you have a weakened immune system? Okay. Do you experience persistent dry eyes? Good. Okay. Any recent changes to your eye or your vision, due to medications, hormonal changes, age, anything like that? Okay. And are you aware of any inflammation of your cornea? Any lid disorders, eye injuries, diseases, glaucoma, cataracts? No? Okay. All right. Well, check it off. All of that is good to go. So now what I'm going to do is perform a very brief physical examination just to see what everything looks like. Okay, just give me one moment. Going to there we go. It's much more official, isn't it? Get my trusty pocket protector. Okay. Now, let me put some gloves on. Basically, what we're going to be doing, checking your eyes. Looking for any problem signs, inflammations, any abnormalities. Okay. You mind? Okay. Take those back off. Okay. Now I'm just going to check your pupils. So, bright light. Oh, look at that. All right. Okay. So far, so good. Let's see. Start there. Okay. Yep, just relax. Okay. Very good. Okay. All right, very good. Let me just make a few notes on your chart. Okay. I don't see any signs of infection, inflammation. I don't see any dryness in your eyes. Pupils look good. Okay. Now, I'm going to do a quick measurement. Okay. And the other side. Yeah, our machine, our device will take more precise measurements in just a moment. But I still like the traditional measurements as well, just for the chart. Okay. The shape of the cornea is consistent with other patients' similar eye condition. The thickness is consistent. Check it off. And I don't see any irregularities, so that is solid. All right. Now, what I'm going to have you do, I'm sure that you are familiar with this chart right here, okay? So I'm going to hold it right about here, and what I'd like you to do, you guessed it, yep, tell me which line is the lowest that you can read. Mm-hmm. Okay. Good. All right. Now, let me, just out of curiosity, put these back on you for a second. Okay. Good. All right. Now, how is your current prescription working for you? Yeah? Okay, good. All right. Great. Take those back off. All right. Yep. I'll give these back in just a moment. So now what I'm going to do is do a detailed scan of your entire eyeball. This is going to measure the surface of it and give us sort of a topographical map of your eyeball so that we can use those inputs for our equipment, and then we can make precise adjustments to your vision. Okay? So this is our multi-use. This is our scanner, plus it also has the laser technology in it to make the adjustments to your eyes. But no worries, we're not making the adjustments yet. This is just the last step in the formal evaluation. Okay? All right, so just relax. I'm going to put this onto your head. Okay? Just relax and relax. And I'm going to count while it's finishing the scan. 6, 5, 4, 3, 2, and 1. Very good. Okay. Before I take these off. Okay, great. All right. So, how was it? That's cool, right? Okay. Put those down for now. And I'm pulling your results up. Okay. Yeah. And let me cross-reference that. Okay. Good. All right. Well, I have great news for you. Based on the health information that you provided me in the beginning and my physical examination of your eyeballs, plus the results that we have for your basic topographical map of your eyeball, you seem like you would make a great candidate for LASIK surgery. Okay, so this is a general overview of your eyeball. This is, of course, a inside look at your eyeball. You have the lens. The pupil is right here in the center, and your iris is the colored part that surrounds. Your cornea is what we will be doing your surgery on. Now, what this entails, if you look up here, you can see a larger picture of this here. We will be making an incision in the outer part of your cornea. We will be moving that flap to the side, which provides us access to this part of the cornea here. At that point, our laser will be able to penetrate and will remove small parts of your cornea to reshape the surface. After that's done, which only takes a moment, it's so quick and so easy, you won't feel anything. Then we're going to replace the flap. You won't need any sutures or anything like that. The eyeball heals extremely fast, and so that will start to heal itself almost immediately. And, the overall healing will take much longer than that, but it will start healing itself very quickly. And after that, flap is put back into place. Boom. You will have better vision. Cool. Yeah. Do you have any questions about that? Okay. I see that you've completed all of the paperwork. And have you arranged for a ride home after the procedure? Okay. Cool. Yeah. We just want to make sure that you're safe and that you have somebody who can take you directly home after the procedure. Okay? All right. Okay. Well, if you don't have any other questions, then we can go ahead and get started. Okay. This is such an exciting day for you. I remember when I got my LASIK surgery done on my eyes, and it has been a life changer for me in so many positive ways. So excited. Okay, so before we get started, what I'm going to do is give you a few chill pills just to take a little bit of the edge off. Okay, all right, dropping some, no big deal. All right, so I'm going to give you a pink one, a black and red one, and a yellow and green chill pill. Okay. All right, so here's those. All right, great. And I have a small cup of water for you to take those down with. Great. Okay. Now, I'm going to remove your glasses. All right. Okay, I'm going to put these over here. You can take them home with you, but that is the last time you'll have to wear those glasses, which is pretty exciting. Okay, now, while we're waiting for the chill pills to settle in, I'm going to place some of these drops into your eyes. These are numbing drops. Now, your vision may become a little blurry. Okay. And, okay. Yes, so your vision now is probably a little cloudy and a little blurry, and that is 100% normal. Okay, just relax and let those settle in. Okay, now what I'm going to do is cover one of your eyes and take a look. Okay. Very good. And the other. Okay, yep. The response is good. All right, yeah, that's looking great. Okay. Now, okay, so now what I'm going to do is I'm going to put our special laser glasses back on. What's going to happen is the machine will do both eyes at once, which is a revolutionary technology. Other clinics will do the eye one at a time and will typically have to use their hands on your eyes during the procedure. Here it is all hands-free, and your eyes are laser tracked during the procedure to make sure that we are precise, the most precise technology available on the market today. So I just want you to relax. This is going to be quick, it's going to be painless, and when you're done, you will be able to see better almost immediately. Okay? All right. Now I know your vision is still a little blurry, and that is totally normal. Okay. So I'm going to put this back onto you. Okay. The machine is going to have you feel a little bit of pressure on both of your eyes, and that is the device making sure that your eyes stay open for the procedure, which won't take very long at all. Now, you're going to see an image in front of you. You see it? Okay, good. Now, you are going to see blinking lights, slow blinking lights, and that is showing you that the device is working And it's also giving you something to focus on. I want you to try your best to focus on the image and the blinking light during the procedure. Okay? All right. And 1, 2, 3. All right, we're going. Okay. It is as simple as that. Now, just relax. I'm going to take the device off of you. Great. Now, I'm sure that your eyes are still a little blurry, and that's okay. Just relax. Okay. I'm just cleaning up some of the tears that happened during the procedure. It is totally normal for the eye to get teary during the procedure. Okay. All right. Now, take these off. And I'm going to grab my chart. Now you should be noticing your vision already a little clearer, but what I want you to do is close your eyes. Yeah, just go ahead and close them. Okay. Now we're going to count together backwards from 10. This will just give your eyes a little bit of time to adjust. 10, 9, 8, 7, 6. Hey, no freaking peeking. No freaking peeking, cheater. 4, 3, 2, 1. Okay. And how is it? Looks a lot better, doesn't it? Yeah. So cool, right? And boom, just like that, you have better vision. That's right. Okay. Now, it's still not, believe it or not, as crispy and perfect as it will be, and you'll notice that your vision will seem to be even more improved by even later on today and tomorrow. Okay? Now, at this point, what I'm going to do is I'm going to give you some aftercare sheets to take home with you, and they have all of the necessary information on them for the care of your eyes. Basically, you're going to use the eye drops that we're going to give you several times a day for the next few weeks to a couple months, depending on how the results are. And these are going to help keep your eyes hydrated and will make the recovery a lot more comfortable and speedy. Okay? So I'm going to take you back out to the lobby to meet your ride home. And what I would like you to do is just go straight home and take a nap. The chill pills that we gave you are probably making you feel a little sleepy, and that's perfect because you're going to go home. You're going to take a nice, restful nap in your favorite place, and after you wake up, you are going to feel incredible, and your eyes will look incredible, and you're going to realize the results of the procedure even more so than you do now. I know everything looks so much better than it did when you came in today. Okay. I want to thank you for choosing me to perform your LASIK surgery at our walk-in clinic today. I hope that it was easy and painless and a relaxing experience, because that is what I hope for. This is going to be a memory that you will carry with you for a long time. And it's important to me that you've had a positive experience. So if there's any feedback, I'm always open to feedback and constructive criticism. If there's anything that you think could be better with your experience today. That being said, do you have any questions at this point? Yeah? Okay. All right. Yeah, well, we try to make sure that we cover all of the bases to make sure that you're well informed so that hopefully there are no last minute questions. Okay. All right, give me just one moment and I'll get all of your things together. Okay. And like we discussed before, I'd like to see you back within the next 2 to 3 days. Okay, 2 mornings from now. Yeah, it's just a brief visit, about 15 minutes long. We're just going to check and make sure everything is healing appropriately for you. And then after that, we'll set up another follow-up that will be months down the road, just to check in with you one more time. Okay. Okay. All right, so I'm going to send you an email with all of the information. You have your physical sheets of information. You have your bag of eye drops that you will use for your aftercare. And you should have everything that you need. You did a wonderful job today. I hope that everything continues to go well for you. And I look forward to seeing you again very soon.